It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, Renzo, how are you?
Hi, John. I'm doing good.
With temps are hovering around 110 degrees, which is normal for us. But things are heating up in the world of prevention of HIV with a brand new drug that you are just dying to tell us about.
Yes. So the generic name of this is called lenacapavir. It has been used now for a couple years as HIV treatment under the name Leca, but it's actually has a very specific indication in HIV treatment. It's basically an add-on for someone who has a lot of resistance to a lot of different drugs, and it's been working amazing. Okay. So now it just got released under the name Yes2Go, basically for prevention of HIV. And the delivery method is actually interesting. It's actually subcutaneous instead of the intramuscular deep injection like the other current injectable medications are. So it tends to be a little bit easier to tolerate. So it's pretty good. And what I like about this, okay, like the studies that were released, they basically did the first set of studies on HIV negative, like cisgender girls and women. It's actually pretty good because the current HIV prevention treatment for women, for patients that are born with vaginas, is basically only Truvada, because apparently Descovy is not very good to use during vaginal intercourse. But this medication is actually pretty good for that patient population. And it basically showed zero HIV infections, which basically led to a 100% reduction. And this was done in sub-Saharan Africa, where HIV is pretty rampant. And so it was pretty promising. So that was like the first clinical trial. And they did another one where they included cis men and transgender men and women and non-binary patients. And they basically saw the same thing. It's a 99.9% prevention rate compared to Truvada alone.
And the big difference is this is twice a year for
Yes,
the injection.
Exactly. And subcutaneous too. So the current one, which is basically the Apretude and the Cabenuva, they're every 2 months. And they actually are like very deep gluteal injections. And a lot of people, they tend not to like the side effects. And so that's why they stop.
Yeah, so they get a lot of muscle pain. It's like you said, it's a deep muscle injection. Who wants
Right.
that? Just give me a little subcutaneous. It's just one little pinch. But yeah, what is the retail cost of something like this?
Yeah. So for this twice a year, roughly 28,000 a year.
Wow.
Yeah.
That's
cash price.
Yeah. And people don't go to the doctors with briefcases full of bills. They, no, do they? Yeah. So that's a lot of money. And it's called Yes2Go. Who comes up with these names? I think they should call it Costs a Big Buckso.
Yeah, that's fitting too.
Yeah. But so just Chugo is a twice a year subcutaneous injection that's really something you can tolerate, and it's not going to give you weeks of muscle pain, which sometimes happens with those deep muscle ones.
That's actually the number one reason why patients, in my experience, have discontinued those medications, just because they're supposed to get better, but in some patients, it just doesn't.
Those studies in sub-Saharan Africa, a lot of them had to do with the funds that were provided by USAID.
Oh, yeah, of course. And so what's really sad about this, right, is I think what I love about this regimen, it's adherence. It's such a problem when it comes to HIV prevention. That's when we see a lot of the transmission, right? And so for the majority of people, it seems like taking a medication every day is okay. It's not that this is a better drug to prevent HIV. It's just that the adherence is so much higher. You only have to do it twice a year. Come on, right?
Yeah, you make an appointment. It's like
Exactly.
a dental, cleaning, and it's less painful.
There you go. Like dental cleaning. Exactly.
Yeah. And back in the day, it was handfuls of pills every single day. They had to be refrigerated. You would get nauseated. So after the injection, are there any bad reactions that people are having that want to steer them away from that?
Not really. So the most common like adverse events are basically like we mentioned, and also including nausea and headaches.
Anything with an injection, you could get a little bit of injection site pain, but
Yeah, it's very common, but yeah.
all right. So yes, to go the new twice a year prep, pretty much.
Yep. Pretty much very expensive.
It's expensive, but if you got good insurance or you're a billionaire with a briefcase full of bills, maybe you could pay in Bitcoin. I don't know. Will it come down in price?
You know what? I don't know, man, because it's still under patent, right? I don't know. That's all negotiated through insurance companies, and Gilead's actually the one that owns this one. So we'll see.
And they have had programs for so many years.
Provided the copay cards and all that stuff in the past. So no, they're in touch.
Boy, look at me applauding Big Pharma. Never
Oh my
thought
God.
that would happen.
You drank that Kool-Aid.
All right. If you would like to send a confidential question to Dr. Renzo Corzano, you can send it to lgbtqhealth@mydohc.com. Ask a Gay Doc is a service of KGay 1065 and 92.1.
And Desert Oasis Healthcare, your health, your life, our passion.
Appreciate the information, Renzo. Thanks.
You're welcome, John.
Stay cool. Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGay channel so you won't miss anything going on in the gayborhood. And you can always listen live to kgaypalmsprings.com.